I assumed that meant the pregnancy was lost. So I was well and truly expecting the worst. Then the doctor came back in. I thought, well, this doesn't normally happen.
In this episode of Beyond the Labour Ward, we're going to meet Jessica. Her first pregnancy was very complicated and resulted in a preterm birth. And then her subsequent pregnancy resulted in trauma and disaster. Let's hear from Jessica. Well, thanks so much for joining us today, Jess. Just really appreciate you coming and sharing your story, and I'm really looking forward to hearing it again. I know all about it, but it's just really great to hear it in your own words. So
you're welcome. Thank you for inviting me. I'm happy to.
Let's start when we first met. Do you remember our first meeting?
I do remember our first meeting. Would have been 2012. So
right. Yeah.
First time I met you, actually you helped me out. First time I met you, I was trying to get pregnant.
That's right. Yes.
And I was having some troubles, and you assisted me with. I had a dodgy thyroid, so you assisted me with that.
Yep.
And then a few months later, I came back. I was pregnant.
Yes, I know.
Yes.
And it was exciting. And
it was very.
And tell us what you were planning to do with that pregnancy.
I was actually planning a home birth with that pregnancy.
Yep.
I've always been very inclined to let nature take its course and do things naturally. So I had a private midwife, and she had suggested I come to see you just to have an alternate kind of backup option.
Yep.
And to get your opinion as to my suitability, I guess, for that home birth process. And
you were about sort of 12 or 13 weeks, I think, at that stage.
At that point, yes, I was. I think I was just come out of the first trimester, or kind of thereabouts, and everything seemingly was going fine.
We made a plan.
We made a plan. We had a plan.
That's right, of sorts.
Of sorts.
Yeah. Which promptly got thrown out the window, didn't it?
Well, I've had other plans, absolutely.
Yes.
So I think it wasn't too much longer after that. I was in your office once again under very different circumstances. So
tell us what happened there.
I had an ultrasound, internal ultrasound, because I'd had a bit of bleeding.
Yeah.
And I got home from that appointment, and effectively my waters broke. I didn't realise that was even possible. I was only 15 weeks and 6 days at that time. So I was very confused and concerned. I didn't know what that meant. And my midwife had, I think, contacted you, and then you called me straight away and said, come on in. I think it was after hours. It was probably about 6 o'clock, after 6 o'clock. And you met me there with your midwife, and you did an ultrasound and pretty much confirmed that my waters had broken and all the water was gone.
Right. Okay. And what do you understand was likely to happen at that point?
Based on my knowledge at that time, I thought, your waters broke when you went into labour. So I assumed that I was going to go into labour and I was going to lose miscarriage and lose the pregnancy. Yeah. So I was heartbroken. It had taken us a long time to get pregnant. And I distinctly remember you saying at the time that there was a strong heartbeat, and whilst there was a heartbeat, there was hope. So you gave me a lot of hope at that time, and we had a plan for me to go home and come and see you again the next day, with the I suppose expectation that I could very well go into labour in the next day or two.
So you went home. I think we gave you some antibiotics.
You did, yes.
And you had my number, and if you started contracting or had bleeding, you'd just come in straight back in. We had a plan.
Yes.
And then I think we just regularly saw you. And miraculously, this little person...
She just tongue-tied. She
kept going.
She was a little fighter.
And I'll be honest with you, it doesn't happen very often like this. And, so then things were progressing, and we got to about 20 weeks, you had the morphology scan.
Yes, yep.
And apart from the water being lost, everything was okay.
Everything was on track.
And she was growing. There was a lot of scans.
There were a lot of scans. But for someone who wanted a home birth with no intervention, there was a lot of intervention and a lot of scans, yes.
And then I have a colleague at another hospital who is a paediatrician.
Yes.
And he had particular interest in women who had prolonged rupture of membranes. Because when a baby's born, after they've had prolonged rupture of membranes, their lungs aren't going to develop right, because they need the fluid in the lungs there to help them develop during the pregnancy, and because she had no fluid in the lungs, it can cause some problems. So I spoke to him, and he was keen to be involved, which was just wonderful.
Yes.
So we ended up admitting you to a university level hospital where he worked.
Yes.
And that was about 24 weeks that you were there.
Yeah, 24 weeks on the day.
There's no point admitting you to hospital before then, because cruel hard fact is that if anything had happened, your baby wouldn't have survived.
Yes.
So
Yeah.
it's amazing you got the 24 weeks.
I was thrilled to get to 24 weeks.
And I think we ended up giving you an injection of steroids.
Yes.
To help give these lungs some help. And then you're under the care of this hospital, and I was sort of from the sidelines cheering.
You were cheering and checking in on me,
yeah.
yes.
Yeah. And then what happened?
So I made it. I remember the mirror on the bedside table next to my bed in the hospital room. I had a countdown on there, so I was counting every day. Every day mattered.
Yes.
And my God, I had milestone objectives along the way.
Yep.
So obviously first one was to get to 24 weeks.
Yep.
Ticked that one off. So my goal was to get to 28 weeks after that.
Yep.
I passed that, got to 29 weeks and 6 days.
Yep.
And then I started having contractions,
Yep.
and had a bit of bleeding, and the contractions started, and ultimately, yes, went into labour.
And now the question is, what position was she in?
Oh, that's right. She was a footling breach pretty much the whole time from when my waters ruptured.
When there's no fluid, they can't turn around as easily.
She could not move.
And so she's a breech presentation, footling breach.
Footling breach. The doctors and the neonatologist had prepared me that I would probably need is it called a classic caesarean?
Caesarean section, yeah.
Caesarean section.
So, which means an incision down the middle of the uterus rather than at the lower segment.
That's right.
And the disadvantage of that is that you can't have any normal births after that.
And as I said, knowing that I had wanted a home birth, and so that was another bit of a blow to my confidence, and I was a bit stressed about that.
But when you've got a baby in this situation, you've got to do what you've got to do.
Absolutely. So anyway, the universe had other plans, and obviously, so I went into labour. I was in labour all day. I think I started contractions about 7 a.m.
Yeah.
At about 4 o'clock in the afternoon, they were preparing me for a caesarean.
I guess they probably weren't doing it straight away because they weren't sure whether you were actually in labour or not.
Correct.
You might have just been having tightenings.
Correct. And they took some bloods to check infection
levels. Yeah.
And when those markers, they had taken several bloods throughout the day and everything was fine, but the last set of bloods had shown that infection was setting in. Yeah. So they were preparing me for a caesarean when I had a cord prolapse. So her foot and her cord started coming out. I remember they were wheeling me into the theatre, and then that happened, and so once again plans changed.
Yes.
And I ended up getting the vaginal birth, natural birth that I wanted, albeit in a slightly different situation and environment. I was in the theatre. There were lots of people around.
So was that process pretty quick?
It was extreme. Well, it felt very quick at the time. And
Normally a breech delivery happens very quickly.
Yes.
Yeah.
So
having a preterm 29-week or nearly 30 weeks, footling breach, cord prolapse, and a vaginal birth.
You just got to go with it.
You just got to go with it sometimes.
It was not what I thought would be the case, but I was so grateful. I was so grateful. That it was the best possible outcome that I was looking at.
Was.
So,
but let's talk about now. So you've got this baby. Who really is going to have trouble breathing.
Yes.
So there would have been a team of doctors there.
There were so many nurses and doctors.
And they would have had to prepare her to help with some assisted breathing. She would have had a tube.
She was ventilated straight away. She didn't come out breathing. So
let's just summarise the next bit, okay? How long did she spend in hospital?
She was in hospital for the first 7 months of her life. She was in intensive, the NICU, the neonatal intensive care unit, for 5 months.
Yep.
And then the last 2 months of her stay, she got transferred to the paediatric ward.
Yep.
So we could actually stay with her for that time. But yes, it was a long journey.
Let's talk about you spending, you navigating that 7 months in hospital with your daughter. When she was in intensive care, did they have somewhere you could stay?
We were able to stay for the first couple of nights.
Right.
They had rooms at the time for families to use when their babies were being discharged.
Right.
So a bit of a stay in, get used to having your baby 24/7 before you get discharged. And fortunately, they were vacant at the time when
so you could
so
stay.
we could use them. But
there comes this point
yes,
where they say you need to go home and come back. I bet
yes.
that was heartbreaking.
That was the hardest thing at that point of my life. That was the hardest thing to do, to like leave hospital without a baby that you just had did not feel right at all. And it was a really it was a horrible day. It was
so going from planning a home birth
yes
and having everything all at home and just being in your own space to just being in this massive institution.
Yes.
And leaving your baby hooked up to a whole bunch of machines and going home. Did you sleep at all?
Not particularly, no. And because I was expressing at the time, I don't think I.
You're on a schedule. You probably got to get up.
I was on a schedule because I found it quite hard to express, and and there was a lot of stress. So, I don't think I slept well.
Yeah.
I still haven't slept well. I think it's been 11 years since I've had a good night's sleep. But no, it was a very hard. So I think after she was 3 days old when we had to come home, and then it was every single day for the next 7 months, driving into that hospital and staying there all day. I was pretty much there from 8 till the morning till about 9 at night every day. For the next 7 months.
And did your hubby go back to work?
He did after about a month or two. I can't quite remember. He had a good amount of time off with me, but then he did go back to work, and then he would come after work. And I remember at the time thinking we were lucky because we didn't have any other children at home, so we could just devote all of our time. And I would see other mums come in with their younger ones, and I just couldn't imagine how they were managing to divide their time up between the sick baby in the hospital and the other ones at home. So we were very fortunate, and my mum cooked dinner pretty much every single night for that whole time. We had a lot of support. We were very lucky, which helped us navigate it because it was a long journey, and her health went up and down in that time. So there were days when they were very hard. We were thinking she was going to need a tracheostomy, or just various health challenges along the way that she had. So they say there's the NICU shuffle. It's one.
So how long was she actually ventilated for?
Almost 3 weeks.
3 weeks, and then on CPAP, I presume.
Then she was on CPAP,
which
for the entire time until she came home on oxygen. She was on CPAP. That whole time.
For those who don't know, is basically where they put positive pressure in the airways to try and keep the airways open. So even when you're breathing in, it's positive pressure, like it helps inflate the lungs. And when you're breathing out, it's like you're breathing out like trying to inflate a balloon. You're pushing against pressure, and it just keeps the lungs open.
Yes.
And it's quite good technology for.
Oh, it was. Yes, kept her alive. So we're very grateful for that. But it was hard. Like it was a good 2 weeks before we were able to hold her for the first time.
And just practical things like, what were you doing for meals? What were you doing?
Yes, so
get your hair cut, that sort of stuff. Like, did you do? Just nothing happened.
Nothing.
The world
there was
stopped.
the odd occasion where we might have left a bit early on a Sunday or something to do something that needed to be done. I remember going to a girlfriend's baby shower, so I left early one day to go and do that. But more or less, we were there the whole time, and it was we'd get lunch at the cafeteria, we'd just pack our meals,
pack
and
lunch,
like I said, we'd come home every night to dinner having been cooked by my mum.
Oh,
bless her, she was fantastic, looking after us. So
it's a community. You need a community around you, don't you?
Yeah, absolutely. But I often joke that I could drive along that road to the hospital with my eyes closed.
Yeah, right.
We did it that many times. It was a very challenging start to parenthood.
She was when she went home, was she on oxygen when she went home?
She was. She came home on oxygen and with a feeding tube. She had chronic lung disease. She was on the ventilator for the first several weeks of life. And
this is because of the ruptured membranes.
Correct.
That's right.
Her lungs just didn't develop.
Yeah.
So she never was able to breastfeed or do suck feeds effectively. So she was tube fed pretty much.
That reminds me.
Oh, yes.
How much express colostrum did you have?
Oh, we ended up buying a chest freezer to store it because
you couldn't throw it out.
I couldn't throw it out. And
so she was getting your milk through the tube.
she was, yes.
Yeah. But you were way ahead of what she needed.
I did end up being way ahead because she was getting such small amounts in those first bunch of weeks.
Yeah.
And so she came home with oxygen and a feeding tube, and both of those were gone just before her first birthday.
Right.
I think it was a week before her first birthday. Her specialist took her off the oxygen and pulled out her feeding tube.
Now, admittedly, she was born 10 weeks early, so she kind of her birthday and her actual...
yes.
But that's okay. So, did this affect her development after that?
Not really, and certainly not as we were told it could have.
Okay, right.
She really was our little miracle baby. She was never re-hospitalised. We were told when she was discharged that there was a high likelihood she would have to come back to hospital possibly every winter because she had a weak respiratory system.
Yep.
Her specialist said that she could have ongoing lung issues.
Right.
I mean, the lungs would continue to develop until she was around 8 years old.
Okay.
But you know what? She met all her milestones
Excellent.
more or less on time and no delays. And if you look at her now, she's happy, healthy 11-year-old, or soon to be 11-year-old.
Yep.
And you would never know she had that start to life.
And does she play sport?
She plays soccer. She loves her soccer. So
Great.
she plays softball. She's very active.
So there's no limitations to her at all?
No limitations.
Okay.
I was told that she might never run a marathon.
Right.
And I said, well, that's okay. Her mum will probably never run a marathon either, and there's nothing wrong with her ones.
Okay, right.
But no, no restrictions. She's perfectly healthy.
Okay, so that's kind of like the bookend to that story.
Yes.
Not sure how to phrase the next one. Let's talk about the next pregnancy.
The next pregnancy. So next pregnancy was about 2 years later.
Yeah.
Started off fine. I was very excited because it happened very quickly.
Yeah.
The first one took a long time for us to get pregnant, and this one was very quick, so I was very excited.
Yeah.
And unfortunately, that one didn't go according to plan either, in a different way. So I think I came to see you at about 8 or 9 weeks, and it was very small for size.
Yeah.
It wasn't where it should have been for that stage. So again, you monitored me and said, I came back for further checks, and then I think at the next appointment that there was no heartbeat. Yeah. So that was another blow. Obviously that was very hard, and I'm a pragmatic person. I know miscarriages are common. I know a lot of people who have had them, but I didn't expect it to affect me the way it did. That really shook me, particularly on the back end of having the first complicated pregnancy. Even though that had a great outcome, I was still quite anxious, I suppose, about pregnancy. So that took me along. I chose to have I don't know what you call it,
Curate.
A natural...
Yes, so we managed it at home.
Conservative management.
Okay,
yes,
that's right.
yes.
Yeah.
So I chose to do that, and it was around 11 weeks that I think it happened. So I had that at home, and then, it took me a while. It took me a long time to kind of recover from that.
Okay.
So...
All right. So the journey continues. How long after that miscarriage did you be able to conceive?
It was 9 months.
Yeah.
9 very long months,
Yes.
I might say.
Yeah.
But 9 months by the end of that year. That was in about March. By the end of the year, I was pregnant again. Very excited to find out I was pregnant again. And I told my husband on his birthday. It was just, not long after Christmas. So, it was very exciting. And not long into that pregnancy, I started to experience a bit of bleeding, which I hadn't had with my other pregnancies. So obviously I thought the worst.
Yes.
I think I gave you a call and you said, come on in and see you straight away.
Yep.
And you did a scan.
And
everything was not only okay, but it was more than okay. There were 2 in there.
There were twins. That's right.
There. Yes.
That was a very nice
moment,
wasn't it?
It was a very nice moment because I was well and truly expecting the worst. My husband was in Queensland on business at the time, and I called him, and he rushed back thinking the worst too.
Yeah.
So to then find that out, it blew my mind.
Yeah.
It was
Okay, now there's different sorts of twin pregnancies, and just for our viewers at home, there's pregnancies where you have two separate eggs or two separate embryos, and they implant, so they have a separate placenta each. Then you have pregnancies where they share a placenta, so they have one placenta with two sacs, and then you have pregnancies where they have one placenta and one sac, which is very rare and that's super complicated. But your pregnancy was one where they shared a placenta, but they had two separate sacs. And so it's all very nice to say we've got twins, but suddenly this becomes quite a complex process because they're sharing a circulation, these babies. And when they share the circulation, sometimes they can become unbalanced where one baby gets more blood than the other baby. So we were looking out for that, because whenever we know that we find a pregnancy like that, we look out for that condition. It's called twin-to-twin transfusion syndrome. And so very early in the piece, we always monitor those pregnancies for that. And so I think about 15 weeks we started.
So I had
stacks of scans.
I had multiple scans again, but yes, it was around the 15, 16 week mark that was actually picked up. The doctor at the ultrasound clinic, I remember the technician did the scan and then she went away and I just sensed something, Then the doctor came back in. I thought, well, this doesn't normally happen. The doctor explained all that to me, and I think the very next day I had an appointment at another hospital.
So we had to do a university level hospital again, a different university hospital this time. There's different hospitals are good for different things, So this one specialises in this particular condition and they have a whole system to treat for that. So you had regular scans down there?
I had, initially it was twice a week. Twice a week for about a month, I think, 3 or 4 weeks.
And just to, again, summarise here, though, if you have this condition, there's like a whole bunch of stages of when it gets, of what's mild and what's severe. And if it gets to a certain severe stage, they can do a procedure where it's pretty hardcore, but basically they put a little tube into the womb, the uterus, and they can block off the circulation where it's too much flow going to one baby, so they can kind of even out the circulation. They call that fetal laser surgery. And this hospital was particularly set up for doing that, which is why we sent you there. But as I understand, there was no, you had never got to those signs. You never got to that stage.
No, it kind of, the levels or the way they measured the condition fluctuated over that time, but it never really met the criteria for being considered, serious enough to look at that surgery, the option.
Because I mean, that surgery, so when you're at the point of doing that surgery, you're certain that one of the twins are going to die, right? So that's so therefore doing something is better than doing nothing. But the problem with doing that surgery, it's also got a risk of 30% of babies dying even doing that surgery. So it's not something you just walk into when it's just a mild thing.
No, I remember at the time doing so much research, and it was a scary time. Knowing all that.
And then things kept progressing.
They did. They kept progressing and they improved to the point where I was advised that I could come back to the hospital where we were booked at originally. And still having a lot of scans to monitor it, but they were improving and seemingly going along fine. So I was starting to breathe a bit because I'd been holding my breath pretty much the whole time to that point. I just started to kind of breathe again and feel like I could start planning things for this pregnancy and the arrival of these boys. Or I didn't know they were boys at the time. And then things changed again. So
just tell us what happened.
So it's very strange. I'd spent the weekend buying baby seats and looking at prams and things like that. On the Monday, I felt a bit off. I couldn't put my finger on it, but I just didn't feel right. And I thought, okay, well, I'm at that point. I was almost 27 weeks pregnant, so I was tired. I had a toddler and working that. I didn't feel so good, but just had a restful day at home. And then the next day I went to work, and as the day went on, I just wasn't really conscious of there being a lot of movement or any movement for that matter. And then I was trying to think of when the last time I actually felt movement. I was doing all the things that that people are told to do, drinking water, lying down. Anyway, got to the point I got quite concerned, so that's when I called you. And And then you met me at the hospital. And you did a scan and there was no heartbeat. I just remember when you told me, and no, I just remember saying both of them.
Yeah.
And how much just, my world just imploded.
Yeah.
I just didn't anticipate that would happen.
Neither did I.
I was expecting premature birth. I was expecting another NICU stay. But the fact that the previous scan I'd had only several days earlier was the best. Like the it was the best scan I'd had. Everything was looking good. So that just completely floored me. I was not expecting that at all. So yeah, that I think I felt like it was surreal. David was with me too, and we just so yeah, that.
So, as a healthcare practitioner, being in that situation, it's just so hard. You don't know what to say.
No, I don't imagine.
All I could do was hug you.
You did, I must say. You were.
And there's nothing that anyone can do. And then we're both crying. I just remember it very well.
Yeah, yes.
And then, as an obstetrician, we asked you to do what I think is possibly the hardest thing in the world to do, and that is to deliver your dead babies. Just, it's so, I'm not sure, you probably went home and then came back a couple of days later, did you?
It was the next morning.
Day,
The next morning, it was a Wednesday.
Yeah.
So yes, you had told me. So this was late in the afternoon, and you made arrangements for me to come back the next day.
Yeah.
And I didn't get much sleep that night.
Yeah.
And so I came in early the next morning, and you induced me.
Yeah.
And they were born later that afternoon. Yeah.
Yeah.
It wasn't a very long labour from my memory, and it was a relatively painless labour. I just remembered I wanted to feel. I didn't want any pain relief.
Yeah.
I think I wanted any physical pain or sensation to kind of numb the emotional pain that I was going through at the time, and I just wanted to be able to.
That's really interesting.
Yeah, I just wanted to
experience it.
I just wanted to experience it all in all its natural form, whatever that meant. So.
And how long between the first boy and the second boy? Was it pretty quick?
Just a couple of minutes. Do you
remember holding them?
I do. Yeah, we were very lucky. We got to spend almost a day with them. A dear friend of ours who is a doula and works in the birthing space, she was able to get a hold of a cold cot. So that they could be in the room with us.
And as a result of that, we actually now own one at that hospital.
Yes. So again, it's one of those things that I'd never heard of before, and obviously you don't go into, having a baby and think of those things. But we were very grateful that was available for us, and it did mean we got to spend some good time with our babies. And our daughter, who at that time was 3, she was able to come into the hospital and meet them. And I remember her being quite fascinated with their little fingers and toes, and she got to hold them, and we had some lovely family photos. So that we're very blessed and grateful for that time we had with them. It was very special, and I remember it like it was yesterday.
Yeah, I did. Yeah. I remember that time sitting with you.
Yes, yep.
Okay, so did you hold a funeral service? What did you do?
We did. We had a very small little funeral service locally in a garden ceremony. Had some dear friends come along and sing songs, and we had little bears made up with a tin heart, so we could put some of that. We chose to have them cremated, so they were together in the same little casket. Yep. And I've got these 2 little bears at home, so which is really nice, because every birthday we celebrate.
So you said, did you put them in the same casket to cremate them?
Yes, they were together. I thought they should be together.
They were together inside you?
Yeah. They were always together, so
Yeah.
it just did not feel right to have them alone.
Yeah. That's great.
So they were in a little, it's like a little wicker basket.
Yeah, yeah.
And this is the surreal thing I thought about. So literally the week before, we were choosing car seats and prams, and then 1 week later, we were choosing caskets for our baby. So it was it was a hard time, but I feel comforted by the fact that they were together.
Yeah.
And we have the ashes at home. We've chose to keep them at home, but there are some of their ashes are in these little tins in these huts. So, we often hug the bears, and they're around us all the time. We take them away with us every year for their birthday. We go away somewhere different as a family. We make an occasion of their of their birthday, and we have a cake and we celebrate and we remember them, and we just we make it a nice
important
time.
part of your family.
Absolutely.
Yeah. So, the journey continued?
It did continue.
Yeah.
I was on a mission after that. I was, I probably became a bit obsessive about getting pregnant again, and it didn't happen for a long time.
No. Yeah.
It took 2 years to get pregnant again, and it was a very hard 2 years, I must say. But
I remember lots of tears.
There were lots of tears and frustrations as to why it wasn't happening, and I was trying everything under the sun, and it just, and I just remember feeling really strongly that there was a wrong that had to be corrected, and I thought I couldn't imagine a future without more children, and especially without having another baby to not to replace my boys, because that could never happen, but I just felt there was this wrong that I needed to right, and the only way I was going to heal was to have another baby. So eventually, yes, eventually we got there.
I remember that phone call. I think it was a text message or a phone call. I can't remember which it was, but anyway, it was beautiful.
It was a long time coming. So,
and so you actually had an uncomplicated pregnancy.
I did. I had the most boring, uneventful, uncomplicated pregnancy.
But every single time you visited me, our heart was in our stomach every time you came. But it was great. But feeling the baby moving regularly gives you that reassurance.
It absolutely does.
Yeah.
And you were so reassuring. You gave me the open invite to come, call you anytime, come in to have checks anytime.
Yep.
You were wonderful with how you work. Every pregnancy you've been wonderful with how you've looked after us. So what could have been a very anxious and stressful pregnancy was actually very enjoyable pregnancy. I mean, it did have its moments of...
I want to talk about the labour. So we got overdue.
We did get overdue.
Overdue, a long way overdue, and I think I was quite nervous.
You were a bit nervous.
Yeah. But eventually I think we had to induce you because you were so far overdue.
Yes, you were wanting to.
Okay, right.
We
planned it.
We planned it.
That's right.
I was. And you had recommended it to me earlier, and it's this weird thing I had in my mind. Because of the previous pregnancies I'd had, I had lost a lot of confidence, and I had lost a lot of trust in my body. And, going back to my first birth, where I wanted the home birth, and I just wanted to let nature take its course and feel everything to do with having a baby and being in labour, and I wanted to give my body the opportunity to do its thing, and I wanted to trust it. I feel like I needed to restore faith in my body because I felt that it had let me down multiple times, and so I was resistant. I was very much obviously wanting her to get here. I didn't know it was a girl, but I wanted safe arrival of baby, but I also wanted to allow my body to do its thing. So, but it wasn't doing its thing. No, so eventually I conceded.
Sounds like I was being a bit of a
terrorist.
No, you weren't.
Anyway. No.
Yeah.
I could see exactly where you were coming from, and again, knowing from my previous experiences and other women I'd met along the way who'd had similar journeys, I didn't want to take any risks or chances either. So, yes, we were booked in for an induction on a Friday morning.
Yep.
And I went into labour naturally.
Of course.
At about 3 in the morning.
That's right. Yeah.
Which again I'm very thankful for.
Yeah. It often happens.
Not that
actually.
I mean, not that being induced would have been fine too. But it really was just this trust. I just wanted my body to do its thing.
And it sure did.
And it did.
It
truly did.
And I think it happened very quickly.
It was a super quick birth.
So I didn't even make it. I was only across the road in the office, but they called me and I was doing the absolute
You walked
flying
in. You walked in just as she was about to come out, I think, and there was a student midwife at the time who had been assisting me on the journey, and you just let her do her thing, and watched, and
that was great.
It was very So my waters broke literally as I got to the birthing suite, and I think she was born about 10 or 15 minutes later.
Yeah, it's great. And now, you suddenly had a baby.
I know.
Who was normal.
I know. I didn't know.
You probably didn't know what to do with yourself.
I had no idea. No idea at all. And I must say that the midwives and the staff at the hospital were fantastic, because they obviously knew my history.
Yeah.
And they helped me, adjust to having a new baby. Because even though it wasn't my first, I didn't know what to do with the newborn.
Were you able to breastfeed?
I was. She was a fantastic feeder. Yeah.
Because you missed all of that with your first one.
And I was, at the time, it was a sadness in me that I missed out on that part of the journey, because that was an important part of the journey in my mind. I got to experience that with April, and she it was fantastic.
Okay, and then again.
And then again.
I think this one was the last one, a planned one, or was it less planned?
She was planned.
Okay, right.
She was totally planned, but still a surprise in the sense that we had been trying for about a year, and given our ages, we're both well into our 40s. I wasn't expecting it would happen. I was hoping, but I kind of was happy just to leave it to fate and see what the outcome would be. So, but when I found out I was pregnant, I was very pleasantly surprised. But it was a surprise, because I didn't think that we would get there again. And once again, I was very blessed to have a very uneventful and boring pregnancy.
Yeah, well, you needed that. You needed to have a normal one. Yeah, another one.
Yep.
And so again, just a lovely normal birth.
Lovely normal birth, a very quick birth again. I had been having contractions throughout the day, but nothing too major, and there was another nighttime, early morning birth. She was, but within 20 minutes of getting to the hospital, she arrived again.
And I actually made this one.
Very quick.
I got this one. Look, I always say to my ladies that if you come to the hospital and you get the baby so quickly that I can't get there, that's a gift.
Yes.
If you're having such an uncomplicated birth that happens that quick, it's a gift.
Yeah.
So, well, that's great.
Yes. So no, I feel very blessed. Obviously, we've had challenges. It hasn't been an easy journey, but I can honestly say that I feel very blessed for the experiences I've had, and all the support I've had. It's I couldn't have gone through it, and especially that first pregnancy. I feel very lucky that I was under your care, because I think things would have been very different if
a lot of other colleagues would have chosen other things.
They
to
would
advise
have,
you.
and I was more or less told that when I was admitted to the hospital. So I feel extremely blessed that you were there looking after us through all our pregnancies. Got 3 beautiful girls, my 2 little angel babies. So I'm happy. I'm very lucky.
You've been through what nobody should ever have to go through. You had an extremely premature baby born, and at least a year of her recovering from that more. Then you had the loss of the twins, which was, I'm still affected by that one. And then you had, been blessed to have 2 normal pregnancies. How has that done to you? How does it change your approach to life? What is it? How do you get through your life now?
Yes, it definitely has changed I often think, particularly after the boy, I think because I had a positive outcome with my first pregnancy, even though that was very challenging and traumatic and scary at times, because I had that positive outcome, I felt extremely grateful and blessed, and it certainly did change my outlook on life. I didn't take things for granted. I was just so grateful. I often say she's our miracle, so I feel extremely grateful that she's here.
Yeah.
Obviously, my feelings after the boys were quite different because that was a devastating outcome. And, each pregnancy has shaped me, but that one I think has shaped me the most. Right. That really did change me as a person. In some ways, I know for the better. It's definitely made me more resilient. It's made me savour life more. It's made me look at life differently. Don't sweat the small stuff. Things like that are kind of mantras in my mind now when I find myself getting worked up. If I find myself being stressed about a situation, I often will remind myself of what I went through, and it's almost like a I don't know, I feeling proud is the wrong word, but I kind of feel like if I can get through that, I got through that. So if I can get through that, then this is nothing. I can get through this. So it empowers me, I think, in moments of stress or tough times. In some ways, I feel like it changed me for the worse, particularly during that time when it was still fresh and I was desperate to get pregnant again and experiencing that very hard journey.
Often find that people trying to, after they've had a big devastating loss, so desperate to fall pregnant and just,
It was like an obsession. If I look back on it now, I really do. It was a preoccupation. It was the only thing that mattered to me at the time, and it was that desperation. And at the same time, obviously, I was grieving, and that was the first time I really had grieved in my life. And grieving's hard work. It's exhausting. And I didn't anticipate the emotions that would come up. There was a lot of anger for a long, long time. I had a lot of anger and sadness, but the anger was the one that surprised me. A lot of guilt. I felt extremely guilty. I still do if I think about it. There's times when, I feel like my body let me down, that I should have done something sooner. I should have known what was going on. I should have come to see you earlier. Like things like that pop into my head every now and then. That still comes up, but so for a while there I felt like it had changed me for the worse. I was angry, I was not very tolerant. I'd hear people complaining about things and I would think, really? Why are you complaining?
First world problems,
But over time I think it's actually made me more tolerant and more compassionate. I have a greater appreciation for people who are grieving and people who are in pain, and I've experienced that huge range of emotions now, so I feel like I can relate more and be more empathetic to others. Certainly to myself. I think I'm a lot more patient and sympathetic to myself at times. That whole thing, be kind to yourself, was a mantra I had to remind myself of throughout that journey. So look, different. And then obviously my last two, the girls, extremely grateful, and I'm just, I feel very blessed and grateful that I did get to appreciate what in my mind was how pregnancy and labour and motherhood should be. And the breastfeeding, all of those things that were important to me at the very beginning, I did get to experience in the end. And I know a lot of women don't get to experience any of that or only some of that. So, I just focus on that. I'm very grateful for that. And, I think motherhood in any way, shape or form changes you. So definitely has. I feel like I'm a lot more resilient, I suppose.
Great.
Yeah.
Well, thank you so much for sharing your story, having a cry with me again.
No, thank you very much. You've been a big part of our life, and we're very grateful, and I'm happy to share. It's happy to talk about my babies, my boys. So thank you.
Anybody out there who's had a pregnancy loss like you've suggested, and they've gone on to their next pregnancy, maybe they're pregnant now, or maybe they're still trying to fall pregnant. Anything you'd like to say to them?
I think just don't give up. Don't give up hope. It's you can't deny it. It's a hard time. It's a hard journey, but it's worth it to get to that other side and to get your rainbow, which we got. Yeah, I think hope's a key theme that I feel has come up over this journey for us. So just don't give up, just keep going, and it's the sun will shine again.
Yeah.
So I say,
You get through it.
you'll get through it.
Okay. Thank you so much for
Thank
coming.
you.
Okay.